Thanks, Dr. Germany, for that fantastic introduction. As Dr. Germany stated, my name is Elizabeth Nekoloff, and I'm here to talk to you about a program that I have developed called Breathe Easy, helping youth in urban areas diagnosed with asthma. Asthma is a chronic respiratory condition that affects people of all ages. However, asthma is the leading chronic disease for children 18 and under, impacting 4.9 million children and affecting African American children at a rate of 2 to 1 compared to their Caucasian counterparts. According to the American Lung Association, several factors can increase the risk of developing asthma, including family history of the condition, if a child had a severe respiratory infection during childhood, allergies, and being exposed to certain environmental triggers. Children living in urban areas with high levels of air pollution are particularly at risk of being diagnosed. Children living in urban areas are exposed to environmental factors that contribute to a diagnosis of asthma that children living in other areas are not. This includes both indoor and outdoor pollutants. The Breathe Easy program, things you need to know. In the Breathe Easy program, we will be serving children ages 3 to 18 living in Cleveland, Ohio. The reason Cleveland was selected was because African Americans and Hispanics make up 60% of Cleveland's population. The children will have recently been seen in the Metro Health Emergency Room. And the reason we selected Metro Health Emergency Room is because we are aware that children living in urban areas have a higher rate of utilization of ER for asthma-related symptoms. And we also are aware that families lack knowledge and/or resources. One of the things about Cleveland is that we have often heard that Cleveland is resource rich. However, there's also been a struggle for families to be able to access those resources. So what makes the Breathe program different? I believe one of the key components that makes the Breathe program different is that the services that we will be offering will be offered in the community. We will not be asking for the family to come to the local medical center, or we will not be asking the family to go to a different community. We will actually be meeting them in their community. They will be able to select the location that they want to meet in. This will be a team approach. It will not only include somebody from the Breathe program, it will include whomever the family feels is important to them, along with medical providers that are providing care to the family. We will be treating the whole family. This will be in a program where we will invite not only the parents and the child with asthma, but any siblings that we feel or that the family feels is important to have at the table. Because the hope is that not only will we educate the child and the family, the child and the parents, but we will also educate the family about triggers and what they should be looking for also. Along with that, the family will be assigned a community health worker, and the community health worker will be the liaison between the family and any other provider or any other system that we need to incorporate in the meetings. This will include, but not limited to, the Cleveland Municipal School District, which most of these children will attend. It will also include people who we have on board to help remediate anything in the home that we feel is a trigger to the child's asthma. One of the key things that the community health worker will be doing is within the first 7 days, 7 to 30 days, no later than 30 days, we'll be making a home visit to walk through the home to help identify what he or she feels might be a trigger and to hear from the family as to what they feel may be triggers for the child who has asthma. What can you expect as part of the Breathe program? You can expect regular meetings to occur. These meetings will be based upon what both the community health worker and the family feel that they need. You can expect a lot of information and a lot of resources, and not just resources, but actually how to access those resources. We will be able to give names and phone numbers so that families will have direct contact with individuals who have been identified for particular um, resources for the family. And they can expect advocacy. The community health worker will not only advocate for the family, but they will help the family advocate for themselves. They will teach the family how to navigate certain systems, and more importantly, with some of the older children with asthma, they will also teach the child how to advocate, as the child is the best person to report what they are feeling, what they think their triggers are, what they feel that they need. So the community health worker will be walking hand in hand with not only the family, but the child with asthma. When it comes to HIT and the role it plays, the community health worker will have access to all health electronic health records. This will help them guide what they are doing for the family and with the family. We will also be able to utilize data that's in the electronic health records, past and present, to identify needs, because there may be some needs that were identified early on that the family is not aware of, so that we can access everything and give them the best information that we have in order to prevent um, further asthma attacks, or in order to prevent them falling through the cracks with their medical providers. When we think about the evaluation of a program, we're hoping to see incidents of asthma-related ER visits decline, but we are also hoping to see the ability to identify triggers increase. That is both between the child and the parents and the family. We are hoping to see that preventative care appointments are scheduled and attended. This is not only for the primary care physician, but this may be for a pulmonologist that the child has been assigned to, and other medical appointments that the child needs to attend. Of course, when you're looking to implement a program, there's one item that you cannot forget to talk about, and that's the return on investment. When we're looking at this, obviously, the initial referral will come from an ER visit. So the hope is that we can prevent some ER visits, so the cost of a primary care visit is much cheaper than the cost of an ER visit. Two other return on investments is obviously the increase in school attendance. A lot of the students with asthma that have an asthma-related incident have a decline in attendance. So hopefully with the school district being at the table during these meetings, there'll be an increase in school attendance, as the student will get what they need at school also. And then finally, the other return on investment is a parent or caregiver's work attendance, and ensuring that they're able to make it to work because their child's asthma is under control and doesn't require for them to miss work. So these are what we're looking at as our return on investments. As the project continues to move forward, I will keep you updated on anything new that we add to the program. And if you all have any questions, feel free to reach out to me. And I look forward to coming back to provide you updates within the next 9 months. At the end of this presentation, I also do have my references that if you would like a copy of them, I'd be more than willing to send them to you. But once again, I thank you for the opportunity to talk to you about this program, and I look forward to reporting back.